Cefepime, know its uses, side effects, and precautions.
Cefepime, a fourth-generation cephalosporin antibiotic, is widely used to treat serious bacterial infections due to its broad-spectrum activity and resistance to many beta-lactamases.
Its rapid bactericidal action and favorable safety profile make it a cornerstone in hospital settings. What is Cefepime? Cefepime is a semisynthetic bactericidal antibiotic classified as a fourth-generation cephalosporin.
It exhibits an extended spectrum of activity against both gram-positive and gram-negative bacteria, with greater effectiveness against both types compared to third-generation cephalosporins.
Approved by the FDA in 1996, Cefepime is administered through injection into muscles or veins under medical supervision. Cefepime is available under various brand names, with Maxipime being the most common in the United States.
Following the expiration of Bristol-Myers Squibb's patent, it became available as a generic medication and is marketed by numerous companies worldwide under names including Neopime, Cepimax, Cepimex, and Maxipime.
What are the benefits and uses of Cefepime? Cefepime is highly effective against a wide range of bacterial infections due to its broad-spectrum activity.
Its ability to combat various pathogens makes it a crucial treatment option in medical settings. Conditions Cefepime treats.
Cefepime is prescribed for several infections, including
pneumonia, lung infections, complicated and uncomplicated urinary tract infections, skin and soft tissue infections,
complicated intra-abdominal infections, in combination with metronidazole. Empiric treatment for febrile neutropenia, fever in patients with low white blood cell counts. Secondary uses of Cefepime. Additionally, Cefepime is sometimes used to treat endocarditis, infection of the heart lining and valves, meningitis, infection of the membranes covering the brain and spine, bloodstream infections. How does Cefepime work? Cefepime works by inhibiting bacterial cell wall synthesis. It covalently binds to enzymes responsible for the final step in transpeptidation during peptidoglycan wall synthesis.
This binding causes defects in the bacterial cell wall, leading to autolysis and subsequent death of the organism. Compared to older cephalosporins, Cefepime is more stable against beta-lactamases, which are enzymes produced by bacteria that can break down and inactivate antibiotics.
This enhanced stability makes Cefepime effective against many resistant bacterial strains. How to use Cefepime. Follow your doctor's instructions carefully. Cefepime is typically administered via injection into a muscle or vein. Ensure thorough understanding of preparation and usage instructions. Key instructions for use. Thaw frozen pre-mixed solutions properly before use. Check for particles or discoloration before administration. Shake thawed solutions vigorously and check for leaks. Use at regular intervals to maintain effectiveness. Cefepime dosage. Cefepime is administered via injection into a muscle or vein as directed by a healthcare professional. The dosage is based on the patient's medical condition, renal function, and response to treatment.
In children, the dosage is also based on weight.
Typical dosage instructions. For adults: pneumonia, 1 to 2 g every 12 hours for 7 to 10 days.
Urinary tract infections, moderate to severe 0.5 to 2 g every 12 hours for 7 to 10 days.
Skin and soft tissue infections, 2 g every 12 hours for 10 days. Febrile neutropenia, 2 g every 8 hours for 7 days or until resolution. Intra-abdominal infections, 2 g every 8 to 12 hours plus metronidazole. For children, 2 months and older. Children weighing less than 40 kilograms, 50 milligrams per kilogram every 8 to 12 hours for 7 to 10 days. Children weighing more than 40 kilograms, same as adult dose. What should I do if I miss a dose? If you miss a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not double up on doses to make up for a missed one. What happens if an overdose occurs? Symptoms of Cefepime overdose may include encephalopathy, brain dysfunction, seizures, neuromuscular excitability, confusion. If overdose symptoms occur, seek immediate medical assistance. What are the side effects of Cefepime? While Cefepime is generally well tolerated, it can cause various side effects.
Most side effects are mild and resolve without intervention, but some can be serious.
Common side effects include headache, diarrhea, pain, redness, or swelling at injection site, gastrointestinal issues like stomach cramps, nausea, or vomiting, skin reactions such as rash or itching, respiratory symptoms like difficulty breathing or swallowing. Precautions while taking Cefepime. Cefepime tablet and injection require caution in certain populations. Who should avoid this medicine? Cefepime should be avoided by people with known allergies to Cefepime, other cephalosporins, or any components of the formulation. Those who have had severe allergic reactions to penicillin antibiotics, use with caution. Conditions where caution is needed. Caution is advised in patients with kidney disease. Dosage adjustment may be necessary. History of seizures or brain disorders. History of gastrointestinal disease, especially colitis. Renal impairment, creatinine clearance less than or equal to 60 milliliters per minute. Are there any age restrictions for using Cefepime? Cefepime is approved for use in patients 2 months of age and older. The safety and efficacy in infants younger than 2 months have not been established. Alcohol or food interactions. There are no specific food restrictions with Cefepime. However, alcohol consumption should be avoided while taking antibiotics as it can reduce their effectiveness and increase the risk of side effects. Possible interactions with other medications. Cefepime may interact with various medications, potentially affecting their efficacy or increasing the risk of side effects. Notable interactions include aminoglycosides, gentamicin, tobramycin, increased risk of kidney toxicity. Warfarin, Cefepime may decrease prothrombin activity, potentially increasing bleeding risk. Live bacterial vaccines, Cefepime may reduce vaccine effectiveness. Immune checkpoint inhibitors, dostarlimab, durvalumab, toripalimab. Cefepime may interfere with their therapeutic effects. Always inform your healthcare provider about all medications, supplements, and herbal products you are taking before starting Cefepime treatment. How should Cefepime be stored? Proper storage of Cefepime is essential to maintain its potency and effectiveness. Follow the storage guidelines provided by your healthcare provider or pharmacist. Recommended storage temperature for Cefepime. Cefepime should be stored away from heat, light, and moisture to maintain its potency. Specific storage requirements may vary by formulation. Unopened vials, store at controlled room temperature, 20 to 25 degrees Celsius or 68 to 77 degrees Fahrenheit. Reconstituted solutions, stability varies by diluent and concentration, follow specific product guidelines. What happens if Cefepime is not stored properly? Improper storage can lead to degradation of the medication, potentially reducing its effectiveness or increasing the risk of side effects. Always check for particles or discoloration before administration, and do not use if either is present. Keep Cefepime and all medications out of reach of children. Properly discard unused or expired medication according to local regulations or guidelines provided by your healthcare provider.